Now, the government has launched the registration into the universal health coverage in Nyeri County, which is among the 4 counties earmarked for the project. Health Cabinet Secretary Cicely Kariuki, while launching the drive at the Nyeri Health Center in Nyeri Town, said that the services under the project are likely to be effected from next month. Nyeri was picked as one of the pilot counties due to the high rate of non-communicable diseases such as hypertension, cancer, and diabetes. Other counties earmarked for the same include Kisumu, Machakos, and Isiolo.
Nyeri ndio iko na 100% of the community health workers who are already there, who are trained. What does that mean for me? It means that you've made my work very easy. What does it mean for you? It means that you're likely to have the highest success rate here. Because whereas we are developing skills in other counties, yako hapa ni kuruka tu na kwanza mambo wakati Mheshimiwa Rais anapofungua huu mradi. Tumeona 10% of non-communicable diseases are driven by road accidents, which we can avoid. Na ndio nashikana na wenzangu mimi kusema nyorosha wale wanaleta upuzi kwa barabara.
This is a pilot, na pilot ni experiment. Tunaweza fanya mambo tufike hapa, tuone hapana, tutabadilisha ni hivi. Walk with us.
So what is UHC and what does it look like and what should Kenyans expect? Those are pilot exercises that have been done, and of course over time the government in their 4-pillar agenda is looking to realize universal health care, which is affordable, which is accessible to all Kenyans as a basic right. Now, to have this conversation, I'm joined this morning by Dr. Silepe, who is from Percival Group Medical Director. He's also a Senior Vice President of Bliss Healthcare. Thank you for joining us.
Good morning.
Morning. Now, let's start off with the fact that you have handled health in different countries, namely, for instance, South Africa. Maybe give us the difference, if there is any, between, for instance, how the healthcare in South Africa, public healthcare, is run in South Africa and in Kenya.
Yeah, the public health sector in Kenya is not much different from South Africa, although there is that slight of difference where most of the people are still reliant on public or government health care delivery, and very few people are reliant on the private health sector. But if you look at the resources that are being available, there is more resources on the private health sector and less resources on the public health sector, where there is more than burden in terms of that. And then when you look at universal health care, what it means then is where you are going to have the majority or all citizens of the country having access to health care without them being really compromised financially. So there where you can have, you develop proper preventative health care, treatment and diagnosis, and even up to palliative care, which is what really this is all about in terms of universal health care.
Okay, so maybe in terms of comparison, what's the difference if you look at it from South Africa and Kenya, for example? Because when you talk about universal health care, 2 things that come to mind is 1, access, and 2, affordability. Affordability and access, when you compare South Africa and Kenya.
The access is where then you would have, in terms of the physical access, the distribution and availability of healthcare facilities, even in rural areas where people really, that's where poverty is, you know. So in South Africa, we've managed to build a public healthcare in such areas and private healthcare in those areas, and then it becomes easy to access in terms of that. But also accessibility, it's not only in a facility, it's what is within the facility. Do you have the right people, the right skill there,
right
within
equipment.
right equipment, the drugs, are they available in those areas? You know, you don't just have an infrastructure that is just a building that is empty, but when people get in there, they still do not find the right service that they deserve, you know. Also, if you look at it, it's not only that. The other determinants of health, the transport system, the availability of clean water in those areas so that you are able to prevent the infectious diseases that come with that, you know. So the level of education, are there those facilities there as well as the determinants, you know, in terms of healthcare.
So access really speaks to quite a lot of things. And like you've mentioned, there's transport. There's also the question of doctors and qualified personnel, yes, especially in the rural areas. Do you feel like Kenya possibly, as we roll out the universal healthcare, has prepared adequately to have enough workforce that is able to go to the rural areas?
Shortage of skills in healthcare is worldwide, you know. And as a country, Kenya needs to go to that level in terms of ensuring that there are doctors, there are nurses, there are skillful healthcare professionals that can be available in those areas. I mean, if you look at maternity, do you have doctors that can do a proper delivery in that facility, if it's there, so that if you look at the MDGs, that we can achieve some of those goals, you know. So it is a difficult problem in terms of a shortage of skills, but I believe that if there's proper planning, there is you can develop that. And there are, like in South Africa, we've introduced incentives for people who go and work in those rural areas, you know. They get certain allowances that are more beneficiary than someone who is working in a city. So that has been the way that we've moved to that level. And we've also developed the communities there in terms of healthcare workers on the ground that can assist in terms of patients.
Okay, do you see that like there is an active, you know, action, especially now that you've mentioned that it's not a peculiarly Kenyan problem, it's a worldwide problem. Are we bridging that gap of difference in terms of personnel and the demand? Because the demand is growing by just virtue of the fact that population is growing, diseases are increasing, people are spreading. Are we bridging that gap?
At the moment it's difficult, but there are endeavors and to try and bridge that gap to provide more healthcare professionals, you know, in terms of also not only relying on doctors, but if you look at our system, we have we're training nurses as well to be able to deliver primary healthcare. That is very much crucial in those developing areas or rural areas.
All right, and we are now joined by the governor for Tharaka Nithi, that is Muthomi Njuki, and Tharaka Nithi is one of the counties where universal healthcare has already been rolled out. Thank you for joining us, Your Excellency. And maybe just to start off with the rollout and possibly what people in Tharaka Nithi should expect with that particular rollout, Mheshimiwa.
Thank you, Mwanagitonga, for looping into the show. First of all, I want to really agree with my friends that universal healthcare is very critical, especially in a developing world, where every day we have demand for better care, and people are very expectant, especially because this is one of the 4 pillars of the 4 agendas of the president. Universal healthcare is not about NHIF, because most people have mistaken universal healthcare to mean NHIF card, that you go to the hospital and be treated for free. It's about ensuring that we have health of our people taken care of all the way from the village to the hospital itself, in that we get involved in the whole some concept of our people, or what would be the patients. If we are able to curb the disease at the level of prevention, rather than taking a backstage and allowing it to go all the way to the hospital because we have NHIF card, then we are not helping our people. In Tharaka Nithi, what we have done is that we have rolled out a program of educating the people by ensuring that we have well-trained community health workers who are given particular villages to take care of, and they go house to house, and they know everybody who lives in the neighborhood and know the history of every household. They know in this household we have somebody who is epileptic, in this household we have somebody with HIV, in this household we have somebody who is expectant, and therefore I have to go encourage them to go to clinic and ensure they're taking their drugs. I have to make sure that patient C, who is in household number B, who is HIV, is taking antiretroviral drugs, and they're also having the proper diet to ensure that at least the drugs are working.
Okay.
That way, we decongest the health centers and the dispensaries and the hospitals. And also ensure that when people go to the hospital, they will find the medicine and they'll find also the personnel, including the lab technicians who will check, they take at least the analysis of what they are suffering from before they see the doctor.
All right.
If you see universal health care in terms of NHIF only, then it is almost futility because people will be careless and will not care because they're being treated for free.
Okay, and what you speak to is mainly access, but the other question, of course, especially for the rural areas, is the question of affordability. Is the government, the local government of Tharaka Nithi, coming in to support and ensure that they subsidize the prices and ensure that it is affordable to the local mwananchi?
Actually, healthcare is very affordable in almost all government hospitals in Kenya. The problem, Bwana Gitonga, is when we do not have availability of these commodities. So if we ensure that in all your dispensaries you have drugs from KEMSA, where if a patient is supposed to buy a particular tablet at 100 shillings, they're getting the same for free at your dispensary, or they are getting it for 10 shillings, then we have affordability. Then the myth of the hospitals, the dispensaries or healthcare being very expensive, and therefore people not going to the hospitals because they are fearing to incur bills, and therefore they stay at home and they normally have the diseases that are going to be extensive to the extent that they cannot be taken care of because they are fearing the bill, is taken care of when you give them health. We give them the NHIF card, or at least they have now a premium, or they have a cover that can enable them to go for, even for tests when you're not sick. Because that is one of our biggest problems when our people think that you only go to hospital when you're sick. That you should be able to go to hospital and know that I'm not well, I'm not feeling unwell, but I've not gone for a test for the last 1 year. So I should be able to go and ask the doctor to check me up and know how is my status. Do I have any signs of maybe early cancer? Do I have any early signs of kidney disease? I mean, all the time, the body is not normally at the optimum level in terms of the way it functions.
Right.
But hardly do we check.
All right.
So we remove the fear.
Okay, Governor, let me just come back to you in just a bit, and let me come to you, Dr. Silepe, and maybe from your, your experience. Rural areas become particularly difficult to reach with access for several reasons. One of those could be just infrastructure, the roads, the network, or even medication that possibly, for instance, requires refrigeration or to be kept in cool temperatures. How do we overcome that? Because that's not something that can be dealt with overnight. Even as much as the medicine may be accessible, it may not be usable because it is not kept in the right conditions that it should be.
It's a serious problem, but I mean, in terms of the government or the health sector that you have, there are means that you can still get those drugs to those areas or medication to those areas, and in terms of transporting them, take all the precautionary safeties. And if the facilities really are there, like we have in South Africa, we have methods of how we store them in terms of you can have cooler boxes, you can have refrigerators, use generators in terms of power in those areas. But like you've said, it's, and basically what happens then, like in terms of the rural areas, it's where you promote mostly primary health care, you know, and people have that access, and mostly preventative illnesses, you know, because it's those areas you can't have a tertiary hospital there, but if you in the rural areas, it's mostly preventative and primary health care that is instituted in those areas.
Okay,
and if it's free, it becomes easy for people to access and the preventing of diseases rather than a curative part.
All right, and in South Africa, is it a national function or is it broken down to the different suburbs and counties?
It's a provincial function.
It's a provincial?
Yes.
Okay, and how has that worked? Because one of the challenges that we found in Kenya, provincial here meaning it would be like a county function, is with devolved health, then it becomes a bit of a challenge when there is money not coming in from the national government, and within the counties, maybe the issue is just accountability.
Well, like in healthcare, you need systems which are efficient and functioning in order to be able to deliver those. And if you work around those systems and make sure that there is proper supervision and management at that level of the province, at that level of also the local authority, because some of the facilities in South Africa belong to the local authority. And those where the system, the national makes policies, and you have a provincial system that is for delivery and implementation on the ground, and then you also have got a local government that is also partly responsible, especially in terms of preventative medicine. Yes.
All right, let me come to you, Governor Muthomi Njuki, on the question of devolved healthcare and whether that works efficiently, or should it remain a national, should it have remained a national function, or how it's working for you, especially when it comes to the resources. The fact that sometimes resources have to be coming from a certain area. Would you rather that is something that you're in full control of when it comes to the health sector?
Well, if there are two sectors in Kenya that have got, I do not want to say problematic employees. I want to say employees that are very organized and they have demands, and sometimes they have unions that are very strong. And whatever they bargain for, they normally use their numbers to be able to ensure that they get it. It is teachers and nurses or health workers in this country. And you can see the number of strikes we have with teachers in this country,
right,
and the number of negotiations they have in this country. We are lucky that the teachers are normally managed from Teachers Service Commission, which is under the national government. It was a very big mistake to have unionized nurses, health workers, being controlled at the county level, yet they have a union that usually bargains countrywide. It means these employees, they are not controlled from the county level, they are controlled by a union that is national. Whatever is happening in Kisumu is affecting the workers of Tharaka Nithi. What is happening in Mombasa is affecting the health workers of Tharaka Nithi. Because even if we have taken care of them, for example, we paid all the dues for the nurses, and then we have something called return to work formula that was a bargain for in the whole country. And they decide, yes, one of them has not been met, and they say we have a countrywide strike. It does not matter whether in Tharaka Nithi have paid them or not. They will still have to go on strike in unison with the others, in solidarity with the others. And therefore, the issue of devolved healthcare, you should have been left with taking care of the hospitals taking care of the drugs, ensuring the equipment are in place, making sure that we do have NHIF and other universal health care matters, and then the salaries should have been taken care of by the national government. At the moment, counties are suffering so much because every county, 75%, in some cases 80% of the wage bill is on the health workers because they have allowances that are in excess of maybe 5 or 6 types, from uniform allowance to extraneous allowance to sometimes are even asking for increment in terms of promotion, which is supposed to be systematic. And in most of the cases, normally it even suppress the agreements by even the other workers.
Okay, and how do you... How do you foresee this challenge being overcome? Because one of the reasons why that wage bill might be very high is by virtue of the fact that maybe majority of the doctors or health workers that you have, for instance, in Tharaka Nithi, are coming from other parts of the country. And as a result, their wage bill will obviously be higher. If you had a localized healthcare personnel, then possibly the wage bill would come down because they're in their home area. Do you think that's an area that maybe needs to be explored?
That is not actually the problem, Mwanagitonga, because Kenyans are Kenyans. They can work in this part of this country, and they always have the same demands. The problem is having salaries that are controlled by SRSC, and they are negotiated somewhere else. The national government is what negotiates. They give them assurances, and they do give them increments, but they do not commensurate that with giving the counties an increment in the allocation that is going to cater for that.
Okay.
How do you negotiate for uniform allowance and extraneous allowance, and you increase it and then you project it to be even double within several months, and you do not give the county that amount of money to match the demands on when that particular agreement comes into force? It's a problem.
Okay. Governor, I'll need to let you go in just a bit, but maybe just as your closing comments, what do Tharaka Nithi people, what should they expect? And maybe give us a timeline here in terms of access and affordability of healthcare in Tharaka Nithi.
Well, we have around 92,000 households in Tharaka Nithi. We have now covered approximately 55,000 households. And therefore, we are expecting the balance that is left. We are talking about covered in terms of NHIF, that you can be able to walk into a health facility and get treated for free and go home. So within the next 2 years, we expect to cover everybody in Tharaka Nithi County to ensure that nobody can be denied health care because they do not have money in their pocket.
Right.
And they should actually be able to access it when they need it. We also have to make sure that our facilities have to up to the standards that are required to ensure that they are all NHIF compliant and they have the drugs and every other service that is required, so that we do not roll out universal health care just by name, but we ensure that it is actually in practice.
All right, thank you very much, Muthomi Njuki, Your Excellency, Governor for Tharaka Nithi, for joining us this morning on call and just breaking it down for us and letting us understand a bit more on national universal health care. But to wind up, Dr. Silepe, your closing comments on what Kenyans should expect, and maybe if this is a piped dream for a developing country to actually imagine that we can have universal health care.
It's difficult for a developing country, but it's possible. It can be achieved. All what needs to happen, we need to pull all the resources that are available within the country into one basket, and then there is a possibility of purchasing the health care for the community or for the population from different healthcare providers at an affordable price, and that is possible. But it is a step-by-step approach, like already as the pilot has been has started in other counties, and learning from the challenges that will be picked up in those pilots, and not there will be challenges, but the key is not to abandon the process, is to work with those challenges, find solutions, and then expand in
All right.
terms of work.
Thank you, Dr. Silepe, for joining us this morning. And in the little Zulu that I know, I'll say siyabonga mfowethu.
Ngiyabonga.
Nkulunkulu wakubusise. Now it's 10 minutes to 9 o'clock, and it's time for us to, well, wind up the show and say goodbye. But do stay with us right here on KTN News.